So, good day everyone. So, this week we're going to discuss an important topic regarding nutrition. So, in this lecture, we have four objectives. First, to identify essential nutrients and their sources. Number two, identify factors influencing nutrition. Number three, discuss essential components and purposes of nutritional screening. And lastly, describe nursing interventions to treat clients with nutritional problems. This topic is very important primarily because you will be managing patients who are more or less sick and more likely requires adequate nutrition in order to facilitate healing and recovery. And as a nurse, you should know what are the different nutrients, vitamins, and minerals needed by the patients in order to improve the situation or the condition. But before that, let us first define what is nutrition. The book says nutrition is the sum of all the interactions between an organism and the food it consumes. In short, it is defined as what the person eats and how the body uses it. And nutrients or nutrition, which are normally sources from food, could either be organic and inorganic substances. And there are three major reasons or major three purposes of nutrients. First, we eat or we need some intakes of nutrition in order to provide energy for body processes. And this energy is very important. Without energy, a person cannot perform daily activities. Number two, providing structural support for the body. That's why our body can move, we can stand, we can walk, and we can do and perform certain activities because of the structural support provided by nutrients. And lastly, nutrients are very important in regulating body processes. There are several body processes in the body. There are vital signs, the other functions of the muscles, of the bones, the functions of the hormone and the enzymes. Nutrients play an important role on those processes. So what are the different nutrients needed by our body? Okay, essential nutrients are divided into two. It could be macronutrients, which compose of carbohydrates, lipids, and proteins. And we also have micronutrients, which includes vitamins and minerals. And we're going to discuss each and every nutrient. One of the most important essential nutrients that is needed by our body is the carbohydrates. And the carbohydrates is very important because it is the main source of our energy. That's why you can perform a lot of activities every day. That's why you can go to school, you can do your work, because you have energy, and the energy comes from carbohydrates. And the carbohydrates is composed of carbon, or hydrogen, and oxygen. And our common sources of carbohydrates normally come from sugar, or the simplest form. Or it could either come from complex forms of sugar such as glucose, fructose, and galactose. Or it could either also be derived from other sources such as starches and fiber. And normally, carbohydrates provide 4 calories per gram. Now, what are the enzymes that are responsible for digestion of carbohydrates? Okay, these enzymes include the thiolin, which are in your saliva, and pancreatic amylase. They are important enzymes because they help in the digestions and absorptions of carbohydrates. Okay, and the term that we use when we describe utilization of carbohydrates in our body is called carbohydrate metabolism. Now, as I mentioned earlier, carbohydrates is a source of energy. However, not all energy are utilized by our body, especially if you do not perform activities, you do not exercise, you just eat. So, not all energy are utilized. So what will happen to the remainder or to the remaining energy or carbohydrates in our body? It is stored as glycogen or as a fat. In short, if you eat a lot of carbohydrates but you do not utilize it, what will happen to these carbohydrates? It will be stored as a glycogen or as a fat. That's why you would see some people who are not exercising but who keeps on eating and eating, they are very fat. Why? Those are stored energy which comes from carbohydrates. Another important source of nutrients are proteins. And proteins primarily help in building and repairing body tissues. Now, this nutrient is very important, especially if your patient has surgical wound or if your patient has a wound. Why? If your patient doesn't have adequate proteins, the wound healing will be delayed. That's why if we have patient who had a surgery or our patient has a wound, we advise them to eat food which is rich in proteins. Now, proteins are composed of 4 elements: carbon, hydrogen, oxygen, and nitrogen. Okay, now, we have these amino acids, and the amino acids make up proteins. Again, amino acids are also proteins. And these amino acids are classified into essential amino acids and non-essential amino acids. Now, this is very important. When we say essential amino acids, these are amino acids that cannot be manufactured in the body. Okay, again, these are amino acids which cannot be manufactured in the body and must be supplied. Since our body cannot manufacture essential amino acids, it is very important that our diet contains amino acids. And what are the examples of amino acids? We have histidine, we have isoleucine, okay, and these are present in the food or supplements. Okay, we also have non-essential amino acids, okay, and these amino acids are those that the body manufactures. That means our body can produce these non-essential amino acids. Unlike with essential amino acids, which we have to look and find in our sources of food. Now, what are the different types of non-essential amino acids? We have alanine and we have aspartic acid. Now, our proteins, the proteins, okay, which comes from our food, provides 4 calories per gram. Another important source of nutrients are in the form of lipids. Lipids or fats. Now, lipids are very important because it provides concentrated source and a stored form of energy. Look at the word stored form of energy. And this type of nutrients is very important in our body. Why? Because it protects internal organs and maintains body temperature. The elements of lipids are carbon, hydrogen, and oxygen. And you would notice that lipids or fats provide higher calories in every gram of food. It provides 9 calories per gram. Now, this is the thing that I want you to remember. While fats or lipids are important as it protects internal organs and maintain body temperature, diets that are consistently high in fats or lipids are not also good to our body. Why? It might lead to obesity or overweight. And if you are obese, if you are overweight, there is an increased risk of cardiovascular disease. That is why, as much as possible, we limit our intake of fats and lipids in our body because of the risk involved in consuming a higher volume of this food. Now, macronutrients, we already know it. Those are proteins, carbohydrates, and lipids. Aside from macronutrients, we also have micronutrients. And from the word itself, micronutrients, which means our body requires a small amount of these nutrients, okay, because it helps in body processes. And micronutrients could either be vitamins and minerals. Okay, I know you are very familiar with vitamins. Now, our vitamins is an organic compound that cannot be manufactured by the body, but it is required by small amount or quantities in order to improve or catalyze metabolic processes. Okay, and when we speak of vitamins, there are two types of vitamins. We have water-soluble vitamins and we have fat-soluble vitamins. Now, what are the difference between the two? Okay, the water-soluble vitamins include vitamin C, vitamin B complex, B1, B2, B3, B6, B9, and B12. We also have pantothenic acid. We also have biosins. Okay? And these vitamins in very small quantities are required by our body because it provides certain protection and it supports some body processes. Like for example, vitamin C, it is very important because it improves our immune system against different types of infection. The same also with the other vitamins. Now, we also have fat-soluble vitamins. We have vitamin A, vitamin D, vitamin E, and vitamin K. Now, our body also requires daily supply of these vitamins in small quantities. Again, it supports body processes. Okay. Now, these vitamins are actually present in most of the food that we eat every day. For example, vitamin C. Okay, it is very common among fruits. You know, oranges, citrus, and other fruits. Okay, the same also with the vitamin A up to vitamin K. All of these vitamins are present in fresh foods, vegetables, and the daily food that we eat. Now, how about minerals? Minerals are found in organic compounds. Okay, and minerals could either be macrominerals and we also have microminerals. Now, what is macrominerals? Macrominerals means these minerals are required by our body in an amount of over 100 milligram per day, such as calcium, phosphorus, sodium, potassium, magnesium, chloride, and sulfur. And you know already what are the purposes and what are the functions of these microminerals. Okay? They support body processes, as we have mentioned in our previous discussion. Microminerals, on the other hand, are required by our body in the daily intake in less than 100 milligram. We have the iron, we have the zinc, we have the manganese, iodine, fluoride, cobalt, and copper. Again, these minerals support body processes, and each of these minerals have their own functions. Okay? We have already discussed that in our previous slides. I will give you an example. Iron. Iron is a mineral, and iron is very important. Why? Because it is helpful in the production of our hemoglobin. What else? Iodine is also an example of mineral. Why? Because it maintains, okay, what? The health of our thyroids. What else? Calcium. Calcium is a mineral and is also very important in order to improve the integrity of our bones. Okay, what else? Chloride. That is very important also for our bones. Now, these are micronutrients. A small amount is required by our bodies, and most of these vitamins and minerals are sourced from the food that we eat. Now, as we have already discussed the different important nutrients in our body, it is important for you to understand what is energy balance. And why is it important for an individual to have an energy balance? Okay. But before that, let us define first what is energy balance. It is the relationship between the energy derived from the food and the energy used by the food. This energy balance is very important as it explains why certain people are obese and overweight and why are some people are thin and underweight. It's all because of energy balance. If you try to look at the slides, you will see, okay, you will see a weighing scale. On the other side, it's an energy intake, and on the other side, it's an energy output. For you to be able to attain an energy balance, the amount of energy that you take from food should be the same amount of energy that, that you should utilize in a day. For example, I'll give you an example. If you are eating a lot of food in a day, certainly you will have a lot of energy. But if you're not going to do certain activities, or if you're not going to work, okay, because your lifestyle is sedentary, what will happen to the energy output? The energy output is less, but the energy intake is high. So there is no balance. So what will happen to the patient? The patient becomes obese. Why? Because the energy is not being utilized. For you to be able to understand energy balance, okay, as I mentioned, energy intake is the amount of food or energy, the nutrients or food supplied to the body. And this energy is called caloric value or calories. As we have mentioned earlier, in every gram of carbohydrates that you eat, there is 4 calories. In every grams of proteins that you eat, there is 4 calories. And in every gram of fat that you eat, there is 9 calories. Okay? And the amount of energy that food supply to the body is measured or expressed in calories. In some books, they call it as kilojoules. Okay? Calories and kilojoules, they are the same. Okay? And we have presented here a conversion. In every 1 kilocalories, it is equivalent to 4.18 kilojoules. So that means, if you are consuming 10 grams of carbohydrates per day, you just need to multiply it by 4. And you take another 10 grams of proteins from your meat. That would be, you multiply it again by 4 calories. And then your intake of fat per day in grams, for example, another 10 grams. Again, you multiply it by 9 calories. You add all those calories, and that is your energy intake in a day. Okay? Now, how about energy output? Remember, energy intake should be utilized or else the person will become obese or overweight. What are the different activities wherein the energy, okay, is utilized by our body? For example, when you do house chores, or if you do certain exercises, or if you do certain activities, those things can actually what? Those things can actually use up, or the energy will be utilized. For example, if you do light housework, okay, normally it can cost 210 utilization of your energy. Okay, walking steadily 350%, heavy housework 400%, average jogging and swimming, actually the expenditure of energy is quite higher. Okay, now the amount of energy required to maintain basic body function is called resting energy expenditure. I want you to observe the different activities presented in the slide. You would notice that average jogging and swimming, the energy that is utilized is very high. That's why if you jog every night, you do exercise, or you love swimming every day, what will happen? Your body remains thin. You do not get obese. You do not get overweight. Why? because your energy are utilized. Okay? Your energy is utilized. But if you do not know activities in a day, your lifestyle is sedentary, you do not move, you just sit, you watch the television, this energy will not be utilized. What will happen? It will be stored as fat. Again, in order to maintain the balance, energy intake should be equal to energy output. Now, with regards to energy balance, okay, in order for an individual or for our patients to maintain healthy or ideal body weight, okay, this requires balance between energy intake and energy output. Why? All of us, we are aiming for ideal body weight, but that is only possible if we are able to maintain a balance between intake and output. Now, we also have this basal mass index. Okay, this basal mass index or BMI, this is an important tool. This is an important guide. Why? Because BMI will actually tell us if the person's weight is ideal. Okay, in fact, BMI or basal mass index is an indicator of changes in body fat store and whether a person's weight is appropriate for height. And sure, by calculating the basal mass index of our patient or ourselves, we will know if we are overweight or if we are obese. So by using BMI, how do we know if our BMI is ideal? Or how do we know if our weight is normal? Or if our weight is overweight? Or if we are obese? The calculation is very simple for basal mass index. You just need to get the weight of the patient in kilograms and you need to get the weight of the patient in meters. And then when you divide the weight in kilograms divided by the height in meters and then multiply it by itself raised to the power of 2, the result is your guide. It will tell you whether the patient is normal, overweight, obese, severely obese, or morbidly obese. Again, get the weight of your patient in kilograms, get the height of your patient in meters, divide the 2, and you will get a normal value. Normally, the normal BMI ranges from 18.5 to 24.9. More than that, your patient can be categorized as overweight, obese, severely obese, or morbidly obese. I will give you an example on the next slide. Okay, here is an example. Okay, you are asked to calculate the BMI of a person. And take note that the height of your patient is 1.7 meters. And the weight of your patient is 72 grams. Now, by applying the formula weight in kilograms divided by height in meters, and then multiplied by itself, it will give you 72 kilograms divided by 1.7 multiplied by itself 1.7, it will give an answer of 24.9. So the BMI of your patient is 24.9. Now, you need to interpret 24.9. Is it normal? Is it overweight? Or is it underweight? Okay, now going back to the interpretation, we know already that 24.9 is a normal weight because the normal BMI ranges from 18.5 to 24.9. Okay? More than 24.9, your patients can be overweight or obese. Now, I want you to do it with your own BMI. I want you to get your height in meters. I want you to get your weight in kilograms. Apply the BMI calculation. And using the categories of BMI, I want you to identify your own BMI. Are you obese? Are you overweight? Or your weight is normal? Okay, I want you to do it by yourself. Now, in order for you to attain a normal nutrition, Okay, there are several guides, okay, that we can use to help us make daily food choices and be active every day. On the slides right now, you will see the food pyramid guide. Okay, what is the importance of this guide? Okay, as you see in the slides right now, okay, the pyramid is color coded. Okay, we have orange, we have green, we have red, we have yellow, we have blue, and we have purple. Okay, each color represents the variety of food or nutrients that our body requires, which means that um, our nutrition should compose or should be sourced from different food groups. That means you should have grains, you should have vegetables, you should have fruits, you should have milk, and you should have meat and beans in your diet. Okay, because each of these nutrients have different functions in our body. You would notice also that each color have different, okay, proportionality or length. For example, the yellow, the green, the red, the fruits, okay, the size is smaller than the vegetables and the grains, okay, and you also the purple, the meat and the beans is smaller than the milk and the vegetables and grains, which means in your intake of nutrients, you should take more grains and vegetables and milk, okay, than fruits and meats. Okay? Again, your food sources should be variety. You should have grains, vegetables, fruits, milks, and meat and beans. However, okay, the proportion, when it comes to proportion, your vegetables, your grains, and milk should be greater in amount compared to fruits and meats and beans. In the food pyramid also you will see a person on the ladder, which means that daily you should remain active. Why? Remember of our previous topic, energy intake should be equal to energy output. Okay? Even though your intake of nutrients is complete, if you will not utilize it, if you will not be active, if you will not perform exercise, if you will not perform daily activities, okay, what will happen? Those nutrients, those food that you have eaten will be stored as fat until the person will become overweight and obese. Now, part of promoting nutrition among yourself or among your patient is for you to be able to accurately read recommended dietary intake. I know you are familiar with the photo on the slides right now. When you buy something in the grocery store, for example, you buy chips or you buy chocolates, when you flip the package, you will see nutrition facts. Okay, almost all food or grocery food that we buy in the grocery store contains nutrition facts. And these nutrition facts contain essential information that will guide you if the nutrients, that the nutrients in the food that you are purchasing is healthy or not. So how do you do this? When you buy a food from the grocery store, flip the package and read the nutrition facts. Now, there are several parts of the nutrition facts that you need to understand. And you start with the green one. Serving size, 1 cup, 228 grams. Okay, see, it means it is the serving size. The contents of the food is 228 grams. Now, when you move to the lower information, you are now checking for the calories. And I want you to observe, the calories per serving is 250 calories. So the food that you bought contains 250 calories per serving. Okay, now, I want you to go a little lower. See the yellow information which says limit these nutrients, which means you need to be careful. Why? Because it contains fat, cholesterol, and food, which means that the food that you bought contains fat, cholesterol, and sodium. And these sources of nutrients should be taken in a very minimal amounts. Why? Because fats, cholesterol, and sodium, when taken in a huge amount, is not good for our body. Okay, when you try to go to the opposite side, the pink colored line, we call it as DV or daily value. See, total fat is 18%, saturated is 50%, cholesterol is 10%, sodium is 20%. Now, how do you interpret this one? The recommended dietary intake says 5% or less is very low, while 20% or more is high, which means that the percentage of these nutrients should be 5 to 20% only. Okay, lower than that, higher than that, it's not good for our body. It might cause what? It might cause problem to our body. So, I want you to look at the fat, cholesterol, and sodium. Is it within the recommended range? Yes, because it is not less than 5, but it is not more than 20%. Now, I want you to move to the green labels, and it says get enough of these nutrients. We have fibers, we have vitamin A, we have vitamin C, we have calcium, we have iron. Say, get enough of these nutrients. It is very important that the percentage of these nutrients is adequate in the food that you are taking. Why? If you take these vitamins and minerals, it doesn't have any side effects at all, unlike with fats, cholesterol, and sodium. Okay. And of course, there is a footnote below that you need to read also. See, there are several informations given there. But the most important thing that I want you to remember is the serving size, the amount of calories on it, okay, the percentage of nutrients which should be limited, and the percentage of nutrients that you should get enough. Now, when you go to the grocery store next time, if you buy some foods, I want you to look at the nutritional facts before you eat the food, okay? And try to check if the daily value is normal. Check if it is not 5% low or not 20% high. Make sure that it contains vitamins and minerals, and make sure that the fat, cholesterols, and sodiums are in less amount. Now that we know already the basic of nutrition, let us discuss what are the different problems that you will encounter in the hospital that is attributed to the nutrition of the patient. One of the most common alterations in nutrition is called malnutrition, which is defined as lack of the necessary or appropriate food substances. Take note, if you are overnutrition, which means you are taking a lot of food, that is malnutrition. Or if you are not taking enough nutrition at all, again, that is malnutrition. Okay, what is overnutrition? Overnutrition refers to caloric intake in excess of daily energy requirement, resulting in storage of energy in the form of fats. So what does this mean? Okay, each individual, we have our daily energy requirement. For example, for me, my daily energy requirement is less than 2,000 kilocalories a day. That's just enough for me so that I can work, I can walk, I can do my daily activities. If my daily energy requirement, let's say for example, becomes 4,000 or 5,000, maybe I keep on eating and eating the whole day. What will happen? Okay, what will happen? Those energy will be transformed as a form of fats. What will happen to me? I will become overweight, I will become obese. Then I am overnutrition. Okay. And the term that we use there is overweight. And normally overweight occurs if your BMI is between 25 and 29.9 kilograms. Remember, the normal is less than 25. More than 25, you are considered overweight. And greater than 30 BMI, you are considered obese. And remember, being overweight, being obese is not healthy. Why? Because if you are overweight and you are obese, there are companion diseases. For example, heart disease. For example, cardiac disease, diabetes, stroke. Those diseases are attributed to overnutrition. Now, if we have overnutrition, there is excess of energy intake, maybe because the patient or the person keeps on eating and eating and eating. We also have undernutrition, which refers to intake of nutrients insufficient to meet daily energy requirements. The amount of energy being taken from the food is very, very low, very, very minimal. So what will happen to the patient? As you can see on this slide right now, if the patient is undernourished, there is undernutrition, you would observe marked weight loss. The patient will be very thin. Aside from that, there is a general weakness. There is no energy at all. Remember, source of energy comes from food. If you're not taking enough nutrients, you don't have energy at all. Of course, in addition to weight loss and energy, your functional abilities is also affected. If you have wound, you would expect that there would be wound healing. In a person is very prone to infection. Why? Because the immune system is poor. Remember, vitamins and minerals are very important, especially vitamin C and zinc. Why? Because they are they boost or they improve our immune system, so we will not get sick easily. What else? A person who is undernourished usually have a problems with pulmonary function. And most importantly for patients, if the patient is undernourished, the patient will be hospitalized for a prolonged period of time. That is how important to maintain the balance between energy intake and energy output. Now, for you to be able to identify the nutritional status of your patient, whether the patient is overnourished, or if the patient is undernourished, or if the patient is malnourished, you can actually perform nursing assessment through nursing history taking. And the first part of your history taking, if you are suspecting a patient with problems in nutrition, is to perform diet history. So how do you perform diet history? You ask and you assess certain things. For example, the patient is undernourished, the patient is thin. Maybe you can check. Maybe there is a swallowing problem. Or maybe there's a chewing problem. Or maybe there's a lack of food budget. That's why the patient cannot eat enough food. Or maybe the problem is food storage. Okay? You need to ask these questions because it will tell you and it will give you an answer why the patient is malnourished. Aside from diet history, you need also to check for medical history. Okay? What are the medical conditions of the patients that could possibly affect the nutrition? For example, alcohol or substance abuse. Most patients with alcohol and substance abuse have poor nutrition. They cannot maintain good nutrition. Why? Because they keep on drinking alcohol and other substances. If your patient is a chronic illness, in most cases, their nutritional intake is also affected. If the patient has a gastrointestinal problem, okay, more or less the patient would have a problem with nutrients. If the patient had surgery in the gastrointestinal system, you would expect that the patient has a problem with nutrition. Now, how about medication history? Perhaps some medications are affecting the nutrients of your patients. You need to ask the patient, what are the medications that you are currently taking? Because some of these medications could have an effect on their nutritional status as well. Aside from nursing history, there's another assessment activity that you need to do in order to assess and check the nutritional status of your patient. And we call this one as nutritional assessment. Specifically, we will measure anthropometric data of the patient. This is a very simple procedure. You just need to quantify body composition. The first one is skin fold measurement. This is specifically important if you want to know if your patient is obese or undernourished. Okay? Skin fold measurement is a procedure that is performed to determine fat stores. Okay? Using a caliper. I want you to look at the photo. The nurse or the doctor is holding a caliper in the upper part of the slides. And the nurse or the doctor is using the caliper. And the caliper can actually measure triceps skin fold. And the normal triceps skin fold of a normal individual with normal nutritional status is 12 mm for male and 20 mm for female. Greater than that, that could mean that the patient might be obese or overweight. Or lesser than 12 and 20, it could mean that the patient might be undernourished. Aside from skin fold measurement, we also have mid-arm circumference. You know the mid-arm, your upper arm. Okay, with the use of tape measure. You know tape measure, right? Okay, with the use of tape measure, you measure the fat, muscle, and skeleton. I want you to look at the photo now. See, the nurse is holding a tape measure, and the nurse is measuring the mid-arm using tape measure. And normally, the circumference, the mid-circumference should be 32 centimeters for male and 28 centimeters for female. Greater than 32 and 28, that means that the patient is obese or overweight. Lesser than 32 and 28, that means the patient is undernourished. If we have mid-arm circumference, we also have mid-arm muscle area. Okay? This one is the estimate of lean body mass or skeletal muscle reserve. Normally, the doctors are the one doing this one. When you go to the hospital, the doctors are the one doing this one. And the normal mid-arm muscle area is 54 cubic centimeters. And for female, the mid-arm muscle area is 30 cubic meter. Okay? We have skin fold measurement, we have mid-arm, and we have mid-arm muscle. Skin fold, we use caliper. Mid-arm, we use tape measure. Now, there are also other tests, laboratory tests, that are performed, okay, in order for you to get the nutritional status of your patient. And one of these laboratory tests is called serum albumin. Okay? A small amount of blood will be taken from the patient, and in the laboratory, the amount of albumin in the blood will be measured. And how does exactly it tells you the nutritional status of your patient? Serum albumin provide an estimate of visceral protein stores. What is visceral protein? These are the proteins inside our body system. And remember, protein is very important for muscle growth, right? If there are less protein in the visceral area, okay, through the serum albumin test, that means that the patient is undernourished. We also have urinary tests, okay? Urea, nitrogen, and creatinine provides measure for protein catabolism and nitrogen balance. Okay, remember, protein is an important source of nutrients. And through urinary tests, okay, you will know that the patient is adequately nourished if the amount of urea and nitrogen and creatinine are within the normal level. Okay, that means there is a nitrogen balance. Lymphocyte count. You know already what is lymphocyte. This is in the blood. Okay? Certain nutrient deficiencies can depress the immune system. Okay. Remember, there are some vitamins and minerals that protects the patient's immune system. And if the patient is not taking enough, for example, vitamin C and zinc, the patient is prone to infection. And when you check the lymphocyte count, you would see that the lymphocyte count is high. The patient has infection. Why? Because the patient is lacking vitamin C and zinc. Aside from the biochemical data, okay, you can also perform clinical data or physical examination in order to determine the nutritional status of your patient. So physical examination is simply examining or assessing the different parts of the body system of the patient. For example, general appearance. You need to describe what is general appearance of the patient. Is the patient thin? The patient is obese? The patient is overweight? You can also try to get the actual weight of your patient. Okay? You can assess the skin of your patient. You can assess the nails, eyes, lips, tongue, gums, muscles, gastrointestinal system, and nervous system. If a patient is overweight, so more or less you would see some deviations or problems on these body parts. If the patient is undernourished, you would also see and observe certain abnormalities in the weight, in the skin, in the nails, in the eyes. Okay, when you go to the community nursing, after 2 years, you will be dealing with children, you will be dealing with people in the community, and you will be asked by your teachers to do physical examination. And with that procedure, you can actually know whether the patient has a nutritional problem. You will know whether a patient is obese. You will know if the patient is undernourished by performing physical examination. Also, next semester, you have the health assessment course. They will teach you how to perform physical examination for your patient. Okay. We also have food diary. It is almost similar with 24-hour food recall. However, in food diary, the patient has to recall the food that they ate at the same time the portion or the amount or the size of the food that they consume. For example, rice. The patient eat rice. Aside from taking note that the food that the patient eat, the patient need also to write the portion or the size. Is it 1 cup or 2 cups? Okay? And you need to specify. Or, for example, chicken. How many grams of chicken did the patient eat? Okay? Or vegetables. How many grams of vegetables the patient eat? And it should be recorded. Diet history, normally this is performed by nutritionist and dietitian. The patient, okay, is usually interviewed by the nutritionist or dietitian, and they will assess, the nutritionist or dietitian will assess, will ask questions to the patients, okay, related to the diet itself. Food diary, the nurse can actually do this. 24-hour food recall, the nurse can do that. Food frequency record, the nurse can do that. Diet history, this is performed by a nutritionist or dietitian. Now, if you have a patient who has a problem with nutritional intake, okay, for you to be able to provide nursing management, you need to identify what are the possible nursing diagnoses. The most common nursing diagnosis for a patient who has nutritional problem is imbalanced nutrition more than body requirements. This is specifically true if your patient is overweight, more than body requirements. If your patient is undernourished, the possible nursing diagnosis is imbalanced nutrition less than body requirements. Okay? This is a potential nursing diagnosis if you can observe that your patient is verbalizing readiness or planning to improve the diet. Okay, your nursing diagnosis is readiness for enhanced nutrition. Okay, now, if your patient has the potential, to have imbalanced nutrients, maybe you observe that your patient is eating a lot of food every day without doing exercise. Okay, you can develop this, a risk for imbalanced nutrition. Perhaps the patient's weight is still normal, but since the patient keeps on eating and eating and eating, there is a risk for imbalanced nutrition. Activity intolerance related to inadequate intake of iron-rich food. Okay, remember iron is an essential component of your hemoglobin. If the patient has less iron intake, the patient might develop iron deficiency anemia. Okay? And one of the most common manifestations of iron deficiency anemia is fatigue and activity intolerance, which means that the patient gets easily tired. Why? Because the iron is very low. Or the patients, when performing things, he easily develops certain vital signs problem. We call it as activity intolerance. Why? Because iron is very low in the body. What else? If the patient has low intake of fibers, your patient is not eating vegetables and fruits, the fiber is very low. What is the possible nursing diagnosis? Constipation related to inadequate fluid intake and fiber intake. Constipation means your patients cannot move a bowel, maybe after 3 days, maybe after 4 days. I'm going to discuss constipation later on. Or if your patient is obese, what is the common problem associated with obesity? If a person is overweight and obese, what will happen? You feel shy. You don't want to go out because many people will mock at your weight because you are overweight. It will affect your self-esteem. And of course, if you are not taking enough vitamins and minerals, you are at risk for infection. Why? Because your immune system will go down. These are the possible nursing diagnoses. Now, when you go to the hospital and you have identified problems with the patients, one of the most common knowledge that you need to learn is special diets. Okay, what are these special diets? These are special preparation of the food of the patient depending on their problem. And this special diet could actually assist patients in healing and fast recovery. The most common type of diet that we have in the hospital is called clear liquid diet. Okay? In short, these are liquids you can see through. What are those? I want you to see the photo on the slides right now. See? The tea, okay? Some soup or broth. These are liquids you can see through. You can give this to your patient if your patient is under clear liquid diet. And this diet, okay, is normally prescribed for patients after surgery and those patients in acute stages of infection. For example, your patient just underwent surgery, abdominal surgery. Do you think your patients will receive solid food right away? Of course not. Why? Because their digestive system may be affected. So the doctor might order, okay, for this patient who had just undergone surgery, give clear liquid diet. Or if the patient is in the acute stage of infection, the diet is normally clear liquid diet. What are these? What are the foods that are categorized under clear liquid diet? See, water, tea, coffee, carbonated beverages, clear juices, and plain gelatin. Okay, these are clear liquid diet. Okay, while this diet is very important, normally it is only provided for short term, only for 24 to 36 hours. Why? Because these are just fluid and carbohydrates. Okay? Short term because they do not provide proteins, fats, and vitamins and minerals. Normally 1 to 2 days only. After 1 to 2 days, the doctor might prescribe another form of diet. Another important diet is called full liquid diet. Okay? This diet contains only liquids or foods that turn to liquid at body temperatures. And normally, this type of diet is given if your patient has gastrointestinal disturbances. What is that? If your patient has diarrhea, if your patient has LBN, these are gastrointestinal disturbances. Or otherwise, unable to tolerate solid or semi-solid foods. Normally, full liquid diet are low in iron, protein, and calories, but cholesterol content is high. What are the examples of full liquid diet that we can give to our patients? Okay, all foods in clear liquid diet. In our previous slides, we can give it to patients in full liquid diet. Plus, we can give also milk and milk products. We can give vegetable oils, ice cream. We can give it to our patient. Peanut butter, pudding, custards, and yogurt. Again, full liquid diet is advisable for gastrointestinal disturbances. If your patient or if you have gastric upset, you are having watery stool, you are having diarrhea, you're having loose bowel movements, this full liquid diet is advisable for you. Another form of diet is soft diet, from the word itself, soft. These are foods that are easily chewed and digested. And these foods are specifically prescribed for patients who have chewing and swallowing problems. Okay? But normally soft diet have low residue diet or low fiber diet. What are the examples of soft diet that we can give to our patients? Okay. Full and clear liquid diets can be taken for patients who are under soft diet. In addition, if your patient is in soft diet, we can give tender meat. You know tender meat, soft meat, fish and poultry. We can also give mashed potatoes and sweet potatoes. We can give food, cooked or canned fruits, bananas, grapefruit. All breads can be given to our patient, including cereals and pasta. You can also give cake and bread pudding to your patient who are on soft diet. Who are those patients who have chewing and swallowing problem? You know, if our patients are elderly, they have swallowing and chewing problems. If our patients have some limitations or have some issues in the mouth, or our patients had been on surgery for several days already, and they are required for soft diet, then we can offer these foods to our patient. We also have regular diet, from the word itself, regular. Okay? For those patients who do not have any problems, we can give them a regular diet. See? Standard or house diet. Just like what we eat at homes. Those are regular diets. Okay? And regular diets normally contains 2,000 kilocalories. We also have light diets. Okay? And this diet is very important for post-operative patients. Okay? If they're not yet ready to take the normal diet, for how many days they're given light diet first. Okay? What are these foods? Okay, these are plainly cooked, and fat is usually minimized. Okay, and most of these foods contains a lot of fibers. These are light diets. We also have other diets which are specific to certain diseases. For example, if your patient has diabetes mellitus, if your patient is diabetic, normally the doctor would prescribe diabetic diet. Okay? And if your patient is obese, normally the doctor will prescribe calorie-restricted diet. If your patient has a cardiac problem, normally sodium and cholesterol is restricted in the diet. If your patient has some allergies, normally the diet is hypoallergenic diet. Now, with regards to diet, special diet, I want you to remember the doctors, the physicians are the one prescribing the diet for the patient. It is not the nurse. The nurse will just implement it. But the one who will choose the diet for the patient is the doctor itself. Okay? And the one who prepares this food are the nutritionists and the dietitians in the hospital. Our role as a nurse is to make sure that this specific diet is applicable for our patient. The one who prescribes, the doctors, the one who prepares the diet are the dietitians in the hospitals. But nurses should know what are the food that is supposed to be given to the patient. Okay? When you work in the hospital, one of the most common challenge among nurses is that most patients, because they are sick, their appetite is very poor, which means they don't want to eat. They don't want food intake. They don't want to drink. So what is now your role as a nurse? It is very important that you stimulate the patient's appetite. So how do you improve the appetite of your patient? Okay, first, provide familiar food that the person likes. If the person doesn't have the appetite, the patient doesn't want to eat, what can stimulate the patient if you suggest or if you provide a familiar food? You can actually tell the dietitian, the patient is familiar with this food, and perhaps if we can serve and prepare this food to the patient, the appetite will improve. Next is select small portions only. If the patient has a poor appetite, do not offer a large portion. Why? The patients will not eat that. You only prepare small portions. Avoid unpleasant treatment immediately before or after meal. If you are performing procedures which is not pleasant, for example, catheterization, or for example, cleaning of the wound, or collection of urine and stool, okay, please avoid those procedures if you are going to serve the patients with food, because the patients will not have an appetite at all if they can see unpleasant procedures. Provide a tidy, clean environment that is free of unpleasant sights and odors. It pertains to the environment. Encourage or provide oral hygiene before mealtime. This is very important. Provide oral mouth care to your patient. Why? Because this improves client's ability to taste. And of course, if your patient is experiencing pain, okay, what will you do? If your patient is experiencing pain, definitely the patient's appetite is poor. So how do you promote the appetite of your patient? Perhaps you can relieve the pain by giving pain medication to the patient before the mealtime. The last is you reduce psychological stress. If your patient is experiencing stress, you need to provide stress management activities. All these procedures could stimulate the appetite of your patient. Okay, aside from stimulating the patient's appetite, one of the important roles of nurses is to assist the client with meals, especially for those patients who are very weak, especially for patients who had surgery. Especially for those patients who are elderly, you need to assist this client with meals. So how do you assist? Of course, first is to offer hand washing and oral hygiene to your patient. Okay? Or you need to position the patients in comfortable position also before the patient eat. Please provide overbed table so there is a space for the tray. Okay? This is very important. Check tray for the client's name, the type of diet, and completeness, because each patient might have different diets. Assist the client as required. For example, when cutting the meat or in pouring the water or tea, you need to assist the client as well. And of course, this is very important. After the client has completed the meal, observe how much and what the client has eaten and the amount of food taken. Now, this is very important. I can observe nurses in the hospital. They just offer the food tray to the patient without assisting the client. Especially if your patient is very weak, you need to assist your client how to take the meals. That is your role as a nurse. Okay, now, when you work in the hospital, okay, you might experience some patients who cannot totally take the food through their mouth. Maybe there's a problem in the throat. Maybe there's a problem in the mouth. And this patient requires alternative way of a modality in order to provide nutrients to their body. And we call this one as enteral nutrition. Again, when you work in the hospital, the patients might not be able to take the food through the mouth. Instead, we provide the food through enteral nutrition. So what is enteral nutrition? Enteral nutrition is provided when the client is unable to ingest foods or the upper GI tract is impaired and the transport of food to the intestine is interrupted. I want you to see the photo. Maybe the baby has a problem with the mouth. Maybe the baby has a problem with swallowing. So how do we provide nutrients? Through the use of enteral nutrition. Through the use of tube. Okay. And there are two types of enteral devices that we can see in the hospital. And these devices could either be nasogastric tube or nasoenteric tube. Is very important because it provides nutrients to our patients. I'm going to show you the photo on this slide. See? On the second photo, you will see that there is a tube inserted directly into the stomach of the patient. Okay? And all food and nutrients passes through this tube directly into the intestine. This is called as nasoenteric tube. The last photo that you will see is that there is a tube inserted into the nasal cavity and it is directed towards the stomach. Again, the food is supplied through this tube, okay, and it will go directly into the stomach of your patient. This is called as nasogastric tube. Now, nasogastric tube is very important. Why? Aside from, as I have mentioned, if your patient has a problem with swallowing or the patient has a problem with chewing, maybe there's a surgery on the mouth or maybe there's a problem with the esophagus, a nasogastric tube may be inserted to the patient. Okay, in the next few weeks when you go to the lab, we will teach you how to insert a nasogastric tube to the patient. We will teach you how to feed the patient using the nasogastric tube. But what are the different purposes why a tube is inserted into the nasal area and into the gastrointestinal area of our patient? First is to administer feeding and to administer medication. The patients cannot take it by mouth, so instead we give the food, we give the medication through the nasogastric tube. Second one, prevent nausea, vomiting, and gastric distension. If your patient keeps on vomiting, I know you already familiar with nausea and vomiting. And the nasogastric tube prevents nausea and vomiting and also gastric distension. Remove stomach content. For example, the gastric content is for examination or testing. We normally remove stomach content using the nasogastric tube. Okay, to lavage, wash the stomach in cases of poisoning or overdose of the medication. If the patient accidentally ingested poisonous substances, poisonous beverages, okay, what will the doctor do? The doctor will insert nasogastric tube and those poisons or overdose medications in the patient's stomach will be washed. We call it as lavage with the use of nasogastric tube. Okay, what else? Nasogastric tubes are used for feeding clients who have adequate gastric emptying and who require short-term feedings. Okay, what else? This nasogastric tube is not advised for feeding clients without intact gag reflex and cough reflexes, since the risk of accidental placement of the tube into the lungs is much higher in those patients. So if our patient doesn't have gag reflex, you know already what is gag reflex, we do not insert the tube because we will never know whether the tube is inserted into the lungs or it is inserted into the stomach. Okay, as previously mentioned, if your patients cannot take the food through the mouth, a tube may be inserted through enteric or nasogastric. However, there is also another alternative way of providing nutrition to your patients without inserting tube to the nose or to the abdominal area. We call it as total parenteral nutrition. Okay? And in this form of modality, the nutrients are given to the patient in a form of intravenous infusion through dextrose. Okay, through IV. I know you already know what is intravenous when you have your discussions on medications. I want you to see the photo. Okay? It is just like an ordinary intravenous inserted to the patient, but it contains nutrition. It contains dextrose, it contains water, fats, proteins, electrolytes, vitamins, and trace elements which are needed in order to maintain the nutrients or the nutritional status of your patients. And normally, TPN or total parenteral nutrition is indicated if your patient has severe malnutrition, severe burns, bowel diseases, acute renal failure, hepatic failure, cancer, or major surgeries. Okay, these are the indications of total parenteral nutrition. However, the problem with TPN, if your patient has total parenteral nutrition, the most common complication is infection. Why? Especially in poor preparation of total parenteral nutrition, your patient is at risk for infection. What else? Since this TPN contains dextrose or sugar, there is a possibility also, if it is not regulated well, it might also cause hyperglycemia or hypoglycemia to your patient, which means the blood sugar could be higher than normal or could be lower than normal. Okay, that is all for today. Thank you so much and have a good weekend.